Good afternoon, everybody. Good afternoon, everybody. The lobbyists, sit down. Hi. Thank you to everybody that has made their way over here. I don't know, it's going to get pretty bad when we have to say to the lobbyists, if you want your bills heard, you make sure that we have people and you bring members on the committee here to make sure they're here so we can get a quorum. Boy, everybody's in a really glum mood. I was being funny. Wow. All right, you have Representative Hawkins, you've got the floor since you have to leave.
Thank you, ma'am. I'm presenting House Bill 872 today. It is LC 339549. This is a bill that addresses and helps to alleviate some of the problems with getting dentists out to the rural areas. This is a dental loan bill. We presently have dental loans for students going out into the rural areas, but it has been my concern over the years that this loan is the student is not aware that he's going to get the loan or has been accepted for the loan until he's established a practice out in the rural area, and then he doesn't know whether he's going to continue to get the loan. It's different for medical students in that they go into a residency, so they're not a student. So this bill, as you will see, mentions dental student in a number of places. And I've got an amendment that I'll speak to now because it's on page 3 before I get any further. It from 100,000, population of 100,000 to 50,000. We're reducing that number to get it out even into smaller towns. But what this bill is going to do is the senior dental student will be notified that they have been accepted for the loan. They don't get the loan until obviously they go out into practice the following year. And also you'll notice on the top of the last page, it speaks to, well, in the middle, on line 79, it speaks to that the student will also be aware that they're going to have the loan for 4 years. I think it's very important for us to ask these dental students going out in rural areas where it's predominantly Medicaid-based practices, due to the low payment of Medicaid, it really helps them to know that they can have that 4-year loan and knock that student dental loan that's over, estimating now $280,000 now, I think is what the average is. It helps reduce that loan and allows them to practice in the rural area. So this will be not only for Georgia students, but also is for students that are graduating from dental schools outside Georgia but moving to Georgia. So in this bill also discusses that the workforce board will also consider where the student's from. Obviously, when you're from a rural area and you go back to a rural area, the chances of you staying in that area are much greater than someone that's never been in that kind of atmosphere. So I started working on this bill in the spring. Actually, the Georgia Workforce Board Director, Chet Besson, started working with Betsy directly, Howerton, on the language of this bill. So it's pretty much generated from that work board. And that's the bill.
Okay, questions from the committee? Okay, who's number 11? Representative Oliver.
I'm very happy to support this bill. I drilled down a little bit and tried to learn about cancelable loans from mental health staffers, and every single bill is different, and the student finance community is difficult. They have a difficult job in the inconsistencies, both federal and state. Madam Chair, at some point, not today, and I'm not volunteering, but somebody needs to do a lot of work on this to figure out how many different kind of rural health medical, because we did one.
That's right.
So there's just an enormous amount of inconsistency out there, and it'd be really helpful if we had a better path that's easier to understand for everybody.
Okay, because I've got one coming, and that probably adds another one that's different.
Yeah. Yeah, the physicians have 2 right now, and their second one is something that I would love to have for the dental students. It's a ballooning. It goes up, starts off and goes up to 50,000 on the last year. But that's for another day. We're gonna fix what we have now. I think.
Okay. Other questions? No other questions from the committee? Okay.
Second.
I have a motion to do pass and a second. Okay, we do have
The
an
amendment, right.
that we need. That is on line 63.
Right.
Is that correct?
Yes,
Changing what we'll be doing is from it says a state with counties in the state with a population of, and marking out 100,000, put it 50,000, it would become 50,000 or less. It's on line 63, page 3. Okay? To make it more that they would go to rural areas. Any discussion? Can I have a motion?
second.
Got a motion and a second. Any other discussion about the amendment? Okay, everybody in favor of the amendment, reducing the population of where these people would go from 100,000 to 50,000, say aye.
Aye.
Anyone opposed? Okay, the ayes have it. Now we have a motion for a due pass on House Bill 872, now as amended, and a second. Any further discussion? All right, then I need a vote on that. Everybody in favor of the House Bill 872 as amended, say aye.
Aye.
Anyone opposed? Okay, the ayes have it. Thank you very much.
Thank you, ma'am.
And nobody else can leave after he leaves because we lose a quorum. Yeah, okay, can you stay for a minute, but don't stay too long. Okay. Okay, let's see. Okay, Representative Williamson is not here. Okay, that would be, well, let me do House Bill 1077 first. House Bill 1077. Okay, this came to us from the Commission on our mental health group. I'll leave my notes. And this pertains to the Behavioral Reform Commission, which I believe, Mary Margaret, weren't you on that commission? The big one?
Yes.
I may be calling it the wrong thing. Okay, and this has to do with trying to get more qualified workers. And this expands loan forgiveness to all licensed professionals in the mental health field. You know, that way encourages them to work in rural areas. And if they do go to rural areas, their amount of loan forgiveness increases. And we're talking about psychologists, social workers, professional counselors, marriage and family professionals. And that's the essence of the bill. Here again with loan forgiveness. Questions about the bill? No? Any questions? No questions? Okay, I need a gotta move, do pass. Are you gonna start screaming like the well as one of your colleagues does? Please don't. Which one? Okay, we're in again. All right, we have a motion and a second. Any further discussion on the bill? Not, everyone in the favor of passage of House Bill 1077, say aye. Aye. Anyone opposed, no. Okay, the ayes have it. Thank you very much. As somebody brought me a bill today, and it was to set up special units in hospitals for the mentally ill in the hospitals, and I need to talk if the hospital representatives are here, and I don't think they are, and that they would provide outpatient therapy and so forth. And I said, who's going to take care of them? Where do we find the psychologists and the social workers to set these up in hospitals around our state? Good idea, but we don't have the people to staff them, I believe. So we have got to encourage people to, okay, and then somebody from the hospital's here, they'll talk to me afterwards about that bill, because I think the one problem with that, with moving it forward, is enough staffing to be able to do it. Okay, so House Bill 1083. Okay, this is Representative Williamson's bill. Last year, there's a special category of mental health care facilities. Stan, what's the name, if you'll take the thing?
Stan Jones, Nelson Mullins, adult residential mental health programs.
Right, and
Many
it's
states have
special.
it, we did not, and many of our programs were licensed as personal care homes instead of having a mental health license.
Okay, and this was to get them a mental health, set up the rules and regulations
That's right,
for them to be licensed.
correct, and new standards, you know, that are higher than the personal care homes, are like the youth residential mental health programs.
Right, and what happened was the department has not,
So regulations have come forward. We've all been working together hard to get a good set of regulations. The first draft was in the summer in October. Skyline Trail, whom we helped, did say we'd like to think about a few other things. We didn't have time to get that done. So this just changes the effective dates in the original legislation. So there's another year and a half to finish up the regulation writing.
right. This has to do with moving the dates on it, so they can continue to work on this. Skyline Trail is one of
Skyline
the
Trail is an
examples.
adult residential mental health program in DeKalb County. It's up on Buford Highway in Druid Hills and
Say it.
also on Claremont Road near Decatur across from the VA.
Okay, push your button.
It's the primary adult program like this now, but other programs will come forward. It's a good idea to have a licensure category for other people to get interested in this over time.
Okay, thank you.
And we would like to ask for the amendment to make it effective upon signature of the governor, because we're in suspense right now, and the provisional licenses need to be reauthorized for a longer period of time.
Okay. So, Representative Hutchinson.
Thank you. And getting over a cold, every test was negative, just saying. This is a great thing. And I was just going to say that Skyline Trail is the best, one of the best facilities. I trust them implicitly.
They've taken care of many of our kids,
Yes.
including Representative Williamson's
Got that, right there. So,
and mine.
okay. Representative Taylor, questions for that?
Thank you, Madam Chair. Just a quick question. Will we be in compliance with the court orders that we had from the Olmstead Act 10 years ago? This won't do anything to jeopardize our...
It does
No.
not. This kind of thing isn't actually invoked by the settlement agreement.
Thank you.
And they are one of our premium, I didn't want to say it too, but without somebody else who works in the field, but they're one of our premium
They're one
treatment
of the
centers.
best in the country.
And the results that they've had with young people is pretty amazing. So, all right, other questions? Okay, do I have, we have motion? And do pass, and a second? Okay, there is amendment, and that would, let's see, the amendments would start, we would change, and just make sure you know what they're doing. It's not on, let's go over that first. On line 20, changing it to July 1, 2025, they would be able to work under their provisional license until we get this settled by that time. On line 30, it goes to June 30th, 2025. On line 38 to July 1st to 2025. And the provisional license would go until that time, and hopefully they'll have it all settled and we can do it. The amendment would be, the act shall become effective upon signature of the governor or upon the act becoming law without such approval. Do I have
I
any
believe that
questions
becomes
about that
the
amendment?
new Section 5, and then the current Section 5 becomes Section 6.
Right. Oh, okay, we got our lawyer.
Thank you.
Thank you. Okay, any questions about it? Where it goes? Okay, do I have a motion on the amendment? Yes. Do you pass? Got a second? Thank you, so that it will, any further discussion? Okay, so House Bill 1083, we have a motion to do pass on this with a second, and now it's as amended. Any further discussion? Not? Everybody in favor of the passage of House Bill 1083 as amended, say aye. Aye. Anyone opposed? No? Okay, the ayes have it.
Thank you very much.
Thank you. Thank you for your work on this. Okay, House Resolution 449. This passed out of here last year. It's about a hypertrophic cardiomyopathy awareness day. It got caught up with all that was going on in the last and got left behind. This is an important issue, and we have lots of days where we're highlighting certain illnesses, and that is all this does. And I got a do pass in a second. Is there any further discussion? Hearing no discussion, everybody in the favor of the passage of House Resolution 449, say aye. Anyone opposed, no. Thank you, the ayes have it, and thank you to every member of the committee, even if we had to call you, for getting here as soon as you can when there's umpteen committees meeting. Thank you, and we are adjourned.